Okay, so once they give you the nursing care plan straight away before you start, you can just divide it. If you are coming to do 4 care plans, you can quickly divide it like this. Okay, if you are coming to do 3 care plans, so you realize that all the time the vigilator or the examiners are going to tell you the time you are starting. Okay, so if you are starting at 8 a.m., quickly, once they give you the care plan, you do the division. Because see, one of the common errors that so far all those who have come around, they are committing is that you don't write the date for all the problems that you've written. Some of you write the date for the first one. Then they are assuming that the second one or the other ones, fine, it's the same date. But we want to understand how you'll be writing care plans during your clinical practice. Do you get it? So some of you will write the first day. So for example, 29th, they will write 29th in the first box. The other ones, they don't write date. In fact, some people, the other ones, they don't even write date and time at all. You get it, which is not good. Okay, so you should write dates. And this is not something that should take you time. So once you are giving the care plan, you've been assigned to a patient, you establish rapport with the patient. Don't talk plenty. Some of you, we give you the care plan, you talk plenty. You don't talk plenty. The time is just 30 minutes. Once they give you the care plan, you just introduce yourself to the patient, mention your name. You get introduced. There are so many things that you can finish doing before you now begin to interact with the patient. That is if the problems that you want to write, they are not objective problems that you can observe and write. That is if you think the problems, you want to find out some subjective problems, the patient have to talk. That is when you are going to interact more with the patient. Is that okay? So the moment we give you the care plan, if you are going to do so, we tell you, oh, you are doing, the time is 9 o'clock. Quickly, you divide the inside of the care plan into what? Into 4. That is if you are coming to do 4. Then you write the date. So 30th. Okay. They gave it to you at 9 a.m. So 30th at 9 a.m. Then the second space, 30th at 9:05. Okay. You write the date, then 9:05. You add 5 minutes to it. Then the third one, the same 30th. Then the date, you add 5 minutes. So 9:10. Then the last one, the same. You write the same date. Then you write the same 30th, the time you can add 5 minutes to the 10 minutes. So at 9:15. Do you get it? Simple as that. Don't write the date for the first space. Then all the rest of the space, you don't write any date. Please. Please, this one is not about exams tension. Okay. It wouldn't fetch you any mark anyway, but make sure you do it. Make sure it is done. Okay. Great. Because this is an official exam. Those who are going to divide their own into 3. This is how the space should look like. Do the division. Use a rule to do the division because you've been informed to come along with rules. Okay, so you do the division like this. Then quickly you write your time. So once we give you the care plan, please learn this practice. This should be the first thing that you do. Do you get it? So you do the division into 3. You write the date, the time that they assign the care plan to you. So if they told you are starting at 10 a.m., you write 10 a.m. Then you write the same date in the next box, the first piece, the date and time. Then you add 5 minutes, so 10:05. Then you write the same date again. You add 5 minutes, so 10:10. You get it like that. That's the first thing you even do. Now, do you realize that those of you who came to my end during the revision, during the preparation for the mock, there was a training or an approach that I took you through. Do you know that so far those who have come, so many people are still committing the error of writing the allergies. Okay, committing this error of writing the problems, the patient's strengths are the allergies, and counselors before they write the known allergies. It's serious. It's serious. I gave you a training, you see, and sometimes if someone is teaching you something from an experience, take it. You are fortunate. You have someone taking you through something from experience. Take that advice. It will help you. It's better than trying to go and do something else. And I realize that if those who commit that error, there are people who are good. Because if you look at the kind of things they are writing in the care plan, you could see there are people who are very smart. Do you get it? after doing this division of the care plan, the first thing you go and write, okay, you write your candidate's index number and then you sign. That's the first thing you write on the care plan. Okay, so you do the division. Once they give you the care plan, you do the division. If you are coming to do 3 care plans, do the division. If you are coming to do 4 care plans, you do the division. There is no problem doing the division and still doing 3 care plans. So someone will say, okay, what if I do the division into 4? Then later I realize that I can only design 3. There is no problem. You divided this into 4. You've done 3 care plans. You will not be penalized in any way. The script will still be marked, just as someone who divided it into 3. It's not a problem. You get it? So after writing your candidate's index number and then signing, the next thing you are going to write is go straight to the space with written allergies and write no known allergies like this, the way it has been written on the slide, just like this. No known allergies. Is that okay? Please make sure in the next word that you are going, those who committed that error, you don't commit that error again. And this is the easiest way to do that. You may think you are smart. You may not know how it will happen. Mostly those who commit that error, if we should show you, you'll be surprised how it happened. And I know some of you, because you canceled it, you get it, because you canceled it and right, probably you will remember. But some people wrote it, and the funny thing is that they didn't even cancel it. I'm surprised. Some people wrote it all. They've wrote patient strength, and they went to the patient strength again and wrote the patient strength. They forgot to cancel the patient strength they wrote under the known allergies. And so it means they are going to lose. They lost the marks for the known allergies. Please, it shouldn't happen again. At least you can cancel it and still write. That is why I'm now teaching you the best way to, take yourself out of that percentage that commits that error. You get? And even now that I'm training you, still, some people will still go and commit that error again. You get it? So please, after your candidate's index number, your signature, you come straight to the known allergies, write the known allergies. Then from there, you come to the routine care. Okay, come straight to the routine care. Okay, the routine care, this is what you are going to write. So the 4 hourly, the TPR, write 4 hourly. The BP, write 4 hourly. The diet is either you are writing normal diet or special diet. If the patient is on any kind of dietary restrictions, write special diet. If you are not aware of that, just write normal diet. That is if you think patient can eat just like you and I. Patient can eat, there are no restrictions. Patient can eat through the mouth. Okay, for example, a patient on NG2 definitely will be on a special diet, like a liquid diet. A liquid diet is a special diet. So instead of writing a liquid diet, you can just go straight and write special diet. That is if you are sure that the patient is on any dietary restriction. We don't use the condition. It's not all or certain specific conditions that there are dietary restrictions. There are some special conditions that there are no dietary restrictions. You get it? So if you are sure there are dietary restrictions, you write special diet. If there is none, you write normal diet. The fluids, either you write liberal fluid or intravenous fluids. Liberal fluids or intravenous fluids. There can be a situation where patients will be on only intravenous fluids, especially now that you are going to surgical. Sometimes immediate post-op cases, sometimes those patients, they will be fasting them. Is that okay? So usually they can be on intravenous fluids, they will be hydrating. Sometimes when they are preparing patient for surgery, usually in the morning or the day before, sometimes they fast the patients, especially if it's an abdominal surgery, a GIT surgery they are going to do, they will fast the patient. So in those situations, patients will be on intravenous fluids. Okay, even though it's not all the time. Another thing is that if you want to find out if patient is on intravenous fluids, you use the intake and outreach chart of the patient. Look through the recent recordings. So, for example, you go through the intake and outreach chart, then you see that 30th, 6 a.m., IV fluid has been given, maybe intravenous normal saline. It will tell you patient is on intravenous fluids. It's simple as that. Sometimes to even the treatment sheet, you are looking on the treatment sheet, you see normal saline, then you see today's date. They've recorded something under normal saline. Someone has signed under the normal. It tells you patient is on intravenous fluids. So these are the ways you can know patient is on intravenous fluids. Is that okay? Great. So far, one of the areas that most of you have done so well, they don't leave a space, unwritten, is the routine care, which is the plus for all of you. You get it? Good. Now, the intake and output, please, the intake and output is two things, okay? Unfortunately, the intake and output, I see some people nursing certain conditions, they write not monitored, and I'm surprised where you learned that thing from. There is nothing like a patient where the intake and output is not monitored. You nurse a patient with severe malaria and you wrote intake and output not monitored. Where did you learn that from? Under no circumstance, I don't think we have any condition you can say intake and output is not monitored. Ideally, every patient on the ward, intake and output should be monitored. So the intake and output is either you write monitored or strictly monitored. It's just two things. Yes, they give you patients with severe malaria or malaria, and you say intake and output, you write not monitored. How? Do you get it? It's either you write monitored or strictly monitored. So if you are dealing with a condition like an unconscious patient, a post-op patient, a pre-operative patient, a patient with conditions like heart failure, chronic kidney disease, those kind of conditions, then you can write strictly monitored. A patient on urethral catheter, like those going to Origin, then you can write strictly monitored. But if you are dealing with a case like typhoid fever, sickle cell disease, a patient with sickle cell disease, then you say not monitored. How? Is that okay? Fine. If you are committing an error in just one, it's not going to deny you the half mark for the routine care. But make sure you are writing the right things. Do you get it? Make sure you are writing the right things. Ideally, if you're able to fill in the spaces over here, you are just able to fill majority of them. You get your half mark. Even if you leave like 3 areas unwritten, you still get your half mark. But make sure you write everything. Is that okay? So the oral hygiene to twice daily, the bathing twice daily, urine testing done on admission, body weight done on admission, activity. Then you write active or passive. Okay, so if the patient is able to sit up in bed without your assistance, the patient is able to turn left, turn right without your assistance, that patient is active. If you are giving a patient who need your assistance before they can sit up in bed. So I see very interesting things. And nurse have come to the ward and I see someone asking, can you get down? Then that is what a person is going to use to define activeness and passiveness. No. A patient can be in bed and still be active, even than you that you are walking. You can have a patient who is in bed and even active than you. The patient don't need to be able to get down first before you consider the patient as active. You are standing in front of a patient who is sitting up by himself. You didn't assist the patient to sit. Patient is able to lie back by himself. And you write passive. No, then it means you don't understand passiveness and active. Once the patient is able to sit up in bed without your assistance, able to turn left without your assistance, turn right without assistance, that patient is an active patient. Is that okay? If you are giving a patient who needs your assistance before they can sit up in bed, the patients need your assistance before they can turn left. Patients need your assistance before they can turn right. That patient is a passive patient. Such patients usually would even require that you help them to eat, because automatically a patient who need your assistance before they can sit up, need your assistance before they can turn left, need your assistance before they can turn right. Obviously, nobody should tell you that patient will definitely need your assistance with feeding and even bathing. Do you get it? Yes, so be very careful with that. The urine testing is done on admission. The body weight is done on admission. Okay, great. So that is basically it for the routine care. Then quickly you come to the back page. Okay, surprisingly, we still have some students who are still losing the 2 marks for the back page. And it's very hard though. And you people make lecturers tuition very hard for us, because when we take our time to teach you things and we're expecting to see you claiming those marks, and people are still committing errors, it gets so funny. Okay, let me ask you this question. Doppler ultrasound, is it other treatment? Doppler ultrasound, is it other treatment? If you go and see Doppler ultrasound, is it another treatment or investigation?
It is investigation.
Yes, and someone is writing it under other treatment. I'm surprised. No, I don't get it all. Is it by force that the other treatment, you have to write something apart from the no other treatment requested? Why is it that some of you is so hard for you? And you are going to write exams. Someone is telling you, write this thing there and come and get your mark. People are trying so hard to write something that is not important there. I just don't get it. I don't know why some of you make the exam so hard for your own self. Just write no other treatment requested. It's not by force that you have to, by hook or crook, find some other treatment and write there. Just write no other treatment requested. Simple as that. Don't go and write anything and commit yourself. Do you get it? Someone will write the other treatment. Someone will write blood transfusion. Then the date started. The person have written not yet started. I wonder. You are saying that patient is on other treatments. The date ordered, then you've written not yet started. How? Then it means you could have, if the patient have not started the blood transfusion, why are you going to a sickle cell patient? Fine, you've heard that they may be doing transfusion. Patients have not started the transfusion, so patient is not on any other treatment. Then the person have written blood transfusion, then the date ordered not yet started. How? Please, just write no other treatment requested and get your half. Mostly the examiners are not going to even get time to go and walk around to go and look at all those things. Just write no other treatment requested. If you are not really sure that patient is on other treatment, or it's not so obvious that patient is on other treatments like chemotherapy, other treatments like speech therapy, diet therapy, like this. These are some of the other treatments. So physiotherapy, chemotherapy, diet therapy, occupational therapy, speech therapy, blood transfusion, dialysis. Do you get it? Oxygen therapy. If patient is not on any other therapy, it's so obvious for you to see. Please just write this one there. No other treatment requested. Simple as this. And get your half. This one, you don't look into book. As simple as this, you get your half. Someone will force and go and write something and then lose the mark. You've been told, write this simple thing and get half. People are struggling to write something to even lose the mark. And mostly, let me tell you, mostly those who write other treatments, you prompt the examiners an attention on your work. They will mostly go and make a reference and check. And that is what I'm saying. If it is not so obvious and clear on the ward you are going, like wards like stroke unit, where we know it's part of their routines, they do physiotherapy. If it is not so obvious with your patients, do not write anything there. Write no other treatment requested. Simple. Because mostly if you go and write something, the examiners, when they are doing the practicals, they are walking around. Okay, they mostly would make an attempt to check what is going on with that patient, whether what you wrote is true. Okay, so please be careful. No other treatment requested. Get your half and go. Fine, majority of you were able to claim all those marks, but people were writing very funny things. And someone will write some of the investigation, go and write one investigation there. I don't know where you went to learn all those things. And at the end of the day, those people will lose the half mark. Else you could have gotten it and then, end up getting, someone can get 19. And then no other treatment. The person wrote funny things there and end up not getting 19.5. You could have hit the excellent or distinction mark. You get it. So please do the right thing. Okay, the investigations. Okay, good. So for Kolebu, all of you would bear with me that it is not possible you get a patient who is not on medication. It is very hard. Most of the patients are not on medication. But if you are doing a care plan or you are in a situation where a patient is not on any medication, this is what you write. No medication ordered. But please, for Kolebu, if you write this, you prompt the examiners to go and check. Okay, it's very uncommon for you to meet a patient who is not on any medication. If a patient is on medication, this is it. Listen carefully. If a patient, there was someone who designed a care plan. Patient is on about 10 medications. 5 of them have been completed. 5 have not been completed. The person wrote only the medications that has been completed. And whilst the 5 that the patient is still on, they are there. Do you get it? Now, the reason is because, see, the reason that if you are not careful, that one you commit an error is because the reason why the person's care plan, you committed an error is because, see, the medications, you've written the medications. Look at the right side, the date completed. Then the date completed, the person wrote in the box, date completed. No, we said date completed. So don't write in the box completed. And I don't think that is what they taught you. You don't write in the space. We want the date that it was completed. You are saying that it is completed. You wrote 5 medications saying it is complete. Write the date that the medications. Don't write completed in the space. That is why I am advising you that if patient is on 10 medications, 5 is ongoing. Okay. Then 5 is ongoing. The rest is not complete. The rest has been completed. Drop the ones that has been completed aside. Focus on the ones that are ongoing. The reason is because if you are writing an ongoing medications, you know that the date completed, you are not going to think or look for any dates. You are just going to write not yet. Some people too were writing ongoing, which is brilliant, which is very brilliant to me. So people like that will get all the score straight. Very brilliant. Is that okay? So they write ongoing. It's correct. Then some two were writing not yet. So if you write medications patient is still taking, then quickly you can write not yet. But if you go and write a medication patient has completed, then it means you may have to find out the date that patient completed the medication. Don't waste time finding the date. Just write not yet, and go. You still get your mark. Okay, don't struggle, be searching for dates. And some of you are forced to write funny things there, completed. Some of you too will write and then write not available. How? The date's completed, then people are writing not available. Some too will write any, not applicable. Please, it's not done. Okay, so you write the medication, you write not yet. Okay, and you realize that now some of you now understand what we kept saying, that in Kolebu, the medications is open dosage. Open dosage because sometimes they don't add the duration, the number of days. If on the treatment sheet, the medications have been written, the number of days is not on it. Please, just add until reviewed. Look at this statement here. Look at this statement, until reviewed. Okay. So if the doctor writes, so look at the first one, you can see the first one is a closed dosage. So see, tablet paracetamol 1 gram, 8 hourly times or 7 days. Tablet paracetamol 1 gram, 8 hourly times or 7 days. You see, it's a complete dosage. So we didn't add any until reviewed. But look at this one, intramuscular pethidine 100 milligram, 8 hourly. Do you get it? This is how the doctor wrote it. The doctor ended at 8 hours. So there is no number of days. So such a situation, add until reviewed. Do you get it? And another thing is that if you write 5 medications, all the 5 medications should come with their own date. Okay, I always advise students, usually the date you are writing here, just use the same date of admission that you wrote. The same date of admission. Don't waste your time going to look for any dates. And sometimes the doctors don't write the dates on the treatment sheet. So use the same date of admission that you wrote. Is that okay? Let's go to the investigations. Now the investigations, this is it. Okay. So far, I think the investigations, many of you are doing well with the investigations. Okay, a few people are also committing errors. Okay, good. So a patient is on full blood count. You've seen the full blood count result. And funny, some people too don't write anything at all at the investigations. And some people don't write anything at all. Is that okay? So please, don't go and commit that error in the next word. Okay, so the investigations, you write full blood count. In fact, most patients you are going to meet in Korle Bu, they are on full blood count. Most of the patients, and many of you will bear with me, this is true. Okay, good. So, and for now that you are even going to surgical ward, most patients, before we prepare them for surgery in Korle Bu Teaching Hospital, they would usually request full blood count and blood urea, electrolyte, and creatinine. Okay, so at the surgical ward, you should even expect an additional to the full blood count, which is the BUE and creatinine. Okay, these two results or these two lab investigations, most patients are on them at Korle Bu. Okay, so full blood count. Then we mentioned that the full blood count, and there are so many things. And now I hope as you've touched into the first word, now you've seen what we kept on saying, that the full blood count, there are so many results, components under it. Okay, so you write the full blood count in capital like this, full blood count, you underline. Then under it, you can just write 4 of the components. So red blood cell, white blood cell, hemoglobin, you can even add platelets to it. Then on the right side, you write the results. Okay, don't write the range, write the results over there. You get it? Now, the error some of you are committing is that the results, you don't add the units to the results. Please make sure you make an effort. You may not lose the mark, but please make an attempt to write the units. Don't just write 5.47, then you leave it like that. 5.0, then you leave it like that. 13.7, then you leave it like that. Make an attempt to add the units. Do you get it? To rate. We can have results like blood, urea, electrolyte, and creatinine. You underline it. Under it, you can just write 4 of the components and write their corresponding results against it. Now, the date audit, please don't go around be searching for the date audit. Sometimes if you see the lab, the dates may be on it. Or if you think the lab, because sometimes patients are having very big folders. Listen to this. The patient is having a very big folder with so many papers. Then you see some old lab. Use it. Maybe the old lab, the date is so long ago. Just use the date of admission and write that date of admission. Because sometimes if the patient is having a very big folder, searching for the lab, it can even waste about 5 minutes of your time. So if you lay hold on one particular lab, you bring it out. Please don't even waste so much time going to look for the dates. Okay, because sometimes the date may be an old date. Use the date of admission, write the date of admission there, and write that lab. In that situation where you think patient is having a big folder that is going to waste your time, okay, make use of that. Be very smart. Is that okay? Great. So now the investigations again. So the investigation, you can have so many investigations. Those who are going to the orthopedic ward, a common investigation that you are expected to write, something like X-ray of the left leg. Then the X-ray will show the patient diagnosis. So if you've gone through the papers, you've seen patient diagnosis, let's say left femur fracture. That is the results of the X-ray. In fact, you not go and see the X-ray and see the results in the X-ray. The results, okay, the X-ray of the left leg, the results is the diagnosis of the patient. So for example, those who are going to stroke, you've seen CT scan. Okay. The result of the CT scan is the patient diagnosis. So if patient is having subarachnoid hemorrhage, that is the results of the CT scan. Is that okay? That's the results of the CT scan. Okay. So especially those who are going to surgical wards, if they've done appendicitis, okay, if patient was diagnosed of appendicitis, they've gone to do appendectomy or something, okay, they will usually do an ultrasound, abdominal ultrasound. Now, the results of the abdominal ultrasound, okay, the results of the abdominal ultrasound is the patient's condition, appendicitis, so inflamed appendix. You get that? That will be the results of the ultrasound that they went to do. Okay, so sometimes some of the labs, the result is actually the patient diagnosis, some of the labs. So please be very smart with that aspect too. Okay, good. But so far, so good with the labs. I think majority of you are doing the right thing. Now let's begin with so I touched that once you are giving the care plan, after writing your candidate's name, your index number, and then signing, the next thing you should write is the known allergies. Then quickly you write the routine care. Okay, that's the second thing that you write. Then you turn to the back page of the care plan. Do justice to the back page quickly. Then now you come and write. Now, the reason why I would advise you to do the back page and get a 2-mark first is that most of the time, by the time you finish writing the medications and investigation, do you know you already know the diagnosis of the patient most of the time? So take the advice. I'm giving you an advice that will save, because see, averagely, most of you are not able to finish the care plan within 30 minutes. Be very honest with yourself. Let's be very honest over here. Yes, because sometimes patients are allowed to, start the care plan. Okay, the candidate is allowed to start the care plan on time. Most of you are not able to finish the care plan on time. You get, so please, and I think all of you would bear witness, that shouldn't be the case. You should be so smart enough, and this is the skill you need to be smart. Okay, so the care plan is not just about having command over the content. Your smartness on how to finish on time too is important, and that is what I'm teaching. And most of the time, by the time you finish writing the medical orders, okay, the medications, other treatments, and then investigate, by the time you finish writing, you already know the patient diagnosed that you need to write under the personal data of the patient. You get it? And most of the informations are the personal data. Those informations are informations that you don't talk plenty. They are available on the patient treatments. Okay, mostly on the nurse's papers, the nurse's notes, the front index sheets, within the patient folder. Those informations are there. Now, a common mistake or a common area most of you are living on field is the patient folder number. The patient folder number. Please do not submit without writing the patient folder number. Is that okay? And we mentioned that once they give you the patients, the bed numbers, usually you already know the ward that you are going. The ward, you're already informed of the ward. Is that okay? Good. You're already informed. For some of you, maybe for some reasons, they've changed the wards that you were asked to go and do the care plan. Find out from the coordinators. Okay, so I was assigned on the list that were distributed. I was informed to go to Polyclinic, or I was informed to go to Orgen. Now, they said I should go and join another group to do for a particular day. They've changed my ward to, let's say, surgical 4. Please, when I go, should I write the surgical 4, or I should write where I was placed initially? Get all those confirmations before you write the ward. Okay, because the ward, officially, it has been done, and mostly it is submitted to council. So if there are any changes, try and coordinate with those who are helping with the coordination so that the right things will be done. Is that okay? So the ward is something you already know. Okay, the bed number, if the ward you are working, the bed numbers have not been written against the patient's beds, you are in charge. You decide how to number the beds. Take that decision reasonably. Don't take the decision in a way that will waste your time. Is that okay? Great. Then the age of the patient, they will all be on the papers. The sex is something that would always be obvious. Is that okay? Occupation. If the patient is a trader, you write. Usually the patient is below 15 years. Sometimes write students over there. If the patient is above 70 years, write retired. Don't stress so much. You get it? Write retired. Okay. Then the physician or surgeon. In fact, the moment you touch on the word, the first thing you ask the nurses around is the physician or surgeon. I was wondering how some of you were not writing anything at the physician or surgeon. Once you touch on the word, one person can just make that inquiry for all of you. Okay, physician or surgeon, we are looking at the doctor who is in charge of that very ward. So one of you can touch down early, make that inquiry for all of you. Please, sister, please, who is the doctor in charge of this ward? Then they tell you, then all of you, you know it. It's not the doctor who admitted the patient, because I see many of you wasting time to find out the doctor who admitted the patient. Please, that is not it. The doctor in charge of the ward is okay. You can write that one there. Not the doctor who admitted the patient, so that you are finding it difficult to to get it, and you waste a lot of time. Okay, so if all of you on the ward, you are having the same thing, it's not a problem. The doctor who admitted the patient is fine. Is that okay? You write then the date of admission to you, right? The date of discharge. Some of you are writing not applicable. No, write not yet over there. Not yet. Okay. Then the operation to is if the patient has not done any operation, you write no operation done. Okay. Some of you to write not yet. No operation done. If the patient have not done any operation, no operation done. The fact that you are going to surgical ward doesn't mean all patients on surgical ward, one way or the other, they will do operations. If patient has not done an operation, write no operation done. Simple as that. Okay, good. We have so many patients on surgical ward who will never go to the theater. Is that okay? So if patients have not done an operation, write no operation done. Is that okay? If the patient has done an operation, don't write operation done. Write that specific operation that was done. Don't go and write operation done. What operation? We want you to write that specific operation that was done. Okay, so if patient has done an operation, go straight and write that specific operation that has been done. Write the name of that specific operation that has been done. Okay, great. So basically that is it. For there. So now we can, any question on the front page? So let me take you through the process again. The first thing you write, your index number, you sign. Then quickly you come to the allergies, write it like this: no known allergies. Okay, some of you to write patient has no known allergies, which is nice, very brilliant. Is that okay? You quickly come to the routine care, you do justice to the routine care, you turn to the back page of the care plan, you write the back page of the care plan. Now listen, if you are able to quickly do this, do you know you have 6 marks comfortably waiting for you? 6 marks comfortably waiting for you. And those students who are able to get 18, 19, most of the time, do you know the interesting thing? Most of the time you reference those students did not lose their 6 marks. They got all these 6 marks straight, because this 6 marks is like a bonus mark. You are not thinking. It's like a bonus. It's not something you are thinking or struggling to write. It's something that has been dashed to you, that write these things in exams and get 2 marks and get your 6 marks. They've been given to you that copy and paste and get your 6 marks. Is that okay? Okay, so now let's look at the care plan proper. If anyone is having any issue, you had any challenge during the exams regarding the areas that we spoke about, let me know that before we touch on the main things. Yes. Okay, that is fine. So then that means that we are all good with the things that we've touched on. Okay, so let's look at the main things. The main things, I'm not going to start with the common things. I'm going to start with problems that are not really common. Problems that you people usually do not write. Okay, before I will now touch on the very common problems. Okay, so far so good. Your care plan is very good. It's not bad. Just that some people are still having issues with the diagnosis. Okay, they write the problem all right, but drafting the nursing diagnosis is still a problem. Even with knowledge deficit, inadequate health knowledge, people are still writing some strange things, which is but fine. Examination pressure, sometimes you may commit some errors that you yourself may not have realized it during the exams. It's fine. Okay, but I'll still touch on some few things. At least you don't commit those errors again. Is that okay? Great. Now, someone was asking a question regarding general body weakness. So a patient is in pain. That same patient is having general body weakness. Okay, then the candidate is asking, okay, can I write the pain and the general body weakness? Why not? You can write. Okay, but the advice I want to let you, or something I want to also bring your mind on, is that once you are sure patient is having general body weakness, definitely that patient will not be able to eat without assistance. So why don't you write those ones? Because see, and the reason is because if you're able to touch on those things, it helps to avoid that problem of always going to write knowledge deficit and anxiety. Because see, if you are saying patient has general body weakness, then the first problem, you can write something like patient complains of pain at so and so part of the body. You write it. Then you can write another problem like patient cannot bath and care for his mouth without assistance. Then you can come and write another problem. Maybe if there is any other obvious problem, you can write that. Then your last or your fourth problem, you can make it patient complaints of general body weakness. Do you get it? And because if a patient is having general body weakness, let's begin to imagine and let's think about it logically. If a patient is having general body weakness, of course, that patient shouldn't be able to bath and care for. Okay, because it will be very contradicting if a patient has general body weakness and that same patient is allowed or is able to bath and care for his mouth without assistance. You get it? So instead of dwelling so much on the general body, we're writing that as a problem. Okay, you can come with patient cannot bath and care for his mouth without assistance first. Then if there are no other obvious problem, you can still keep the general body weakness as a fourth problem. Do you get it? Because if you write patients complain of pain at so and so parts of the body, patient complain of general body weak is some way, because writing it together that way, it appears some way. It will sound or it will create an attention quickly. But fine, if you write patient complain of pain somewhere, then because of the general body weakness, you can write patient cannot bath and care for his mouth without assistance, or patient cannot eat without assistance. You get, then maybe if you are lacking, you are not seeing any obvious thing to write that is in your situation, which I think wouldn't happen. If you are not seeing any obvious thing to write, then you can now write patient complain of general body weakness. It's fine. It's not a wrong problem. It's good. Okay. It's not a wrong problem. I saw a few of you writing that. It's good. It's brilliant. Okay. But what I'm drawing your attention to, if a patient is having general body weakness, then you should expect patients unable to bath. Is that okay? Without assistance. Okay. So that at least that issue of all the time writing knowledge, at least you'll be able to take yourself out of that percentage. You get it? Because now that we are touching to day 3, yes, we might have done so many of those educations. Do you get it? All right, that is fine. That doesn't mean that if you are lacking problem, you can't write knowledge deficit. If you write, you'll be marked correct. Yes, if you write knowledge deficit, you'll be marked correct. That doesn't mean if you are lacking problems and that is what you remember to write, please, it's better than submitting it empty. Do you get it? Yes. Good. So let's look at some of the problems. How, if a patient is having general body weakness, how are you going to write a problem? So look, patient complains of general body weakness. You see, look at how we write the patient strength. Patient is conscious and able to express needs clearly. It's a strength. So you see, you are saying patient has general body weakness. That patient is conscious and the patient is able to tell you his or her needs. It's a strength. Okay, so patient is conscious. And because some of you write general body weakness, but you don't know how to write a strength. Patient is conscious and able to express her needs clearly, his needs clearly. It's a very good strength for the patient. Is that okay? Great. So you see how the problem has been written. Patient complains of general body weakness. Let's look at the second problem. Okay, so they give you patients on oxygen. Hey, sometimes it's interesting. Look, they've given you patients who is on oxygen. Then you said patient don't have any problem. And another thing is, you are talking plenty. What talking plenty are you going to do? Imagine you were on oxygen. You definitely have difficulty breathing. That's the reason why you're on the oxygen. So you shouldn't ask the patient, what is your problem? Okay, because I observed that many of you've not developed the skills of identifying objective problems. You know, some problems are objective. Focus on those ones first. If you don't get the objective problems, then now you come and do the subjective problems. The subjective ones are the ones that you may need patient to tell you, like pain. Do you get it? Pain, general body weakness, dizziness, and those things. Those problems are usually subjective. But apart from that, there are objective problems, like a patient on oxygen, like an unconscious patient. Most of the problems are going to be objective. You have to do observation. Do you get it? So that is something you people should work on. There are so many problems on the world that are objective problems. You don't need to talk plenty. They are there. Patients on oxygen. Definitely, patient is having difficulty breathing. Okay, so that one, if, for example, the patient is not talking, you can write, patient has difficulty breathing. Because someone will say that, say, why is it that? So you see, I use two ways. Patient has, or you see how it is. So if you identified it objectively, then you write, patient has difficulty breathing. Patient has difficulty breathing. But if you identify this subjectively, then you write, patient complains of difficulty breathing. Have you gotten it? So once they give you the patient is not unconscious, but patient is on oxygen. You can quickly write, patient has, don't go and ask the patient, are you having difficulty breathing? The patient is on oxygen. And the candidate is asking, please, are you having difficulty? Yes, that's the reason patient is on the oxygen. And mostly such a patient, they will have chest pain. No? A patient on oxygen, they will definitely have chest pain. So you get two automatic problems. Chest pain, patient complains of chest pain, patient complains of difficulty breathing. Easy as that. Then you can add anxiety to it, because a patient who is on oxygen, we those who are walking normal without oxygen, we are even anxious, not to talk of a patient who is on oxygen. Do you get it? So patients on oxygen, you get three automatic problems straight. Patient complains or patient has difficulty breathing. Patient complains of chest pain. Do you get it? So patient has difficulty or complaints of difficulty breathing. You see how it has been written. Let's look at the strength. Patient complains of difficulty breathing. If patient can sit up in bed, it's a strength too. So that one is not here. But look at what is here. Patient is cooperative and willing to participate in care. But if patient can sit up in bed, okay, that one is also a very good strength. Or patient can assume an upright position. Do you get it? Yes, that one is also a very good strength that you can write. So patient can sit up in bed, or patient can assume an upright position. It's a very good strength for patient complaints of difficulty breathing. Someone was also asking a patient with edema. Okay, so you look at the patient, the leg is swollen. It's a problem. Yes, it's a problem. Because for we normal people moving up and down, you don't have any swollen leg. There is a swollen hand. It's a problem. Okay, so you can write, patient has edema at the lower abdomen. You see how it is written. Or patient's left leg is swollen. Or patient has swollen feet. You see how it is. So patient has swollen feet. Or patient's left leg is swollen. Patient's lower limbs are swollen. It's a problem. So you check the patient's feet. Like you see an old woman, you check the feet, the leg is swollen. It's a problem. So patient's lower limbs are swollen. Patient's right leg is swollen. Patient's left leg is swollen. It's a problem. Okay, so patient has edema at the lower abdomen. Do you get it? That one too is another way you can write it. Okay. So patient's left leg is swollen. Patient has swollen feet. You get that is also a problem. Let's look at how we can write the strength. So if patient's leg is swollen and patient has a stable vital signs or vital signs that is within the normal limit, it's a strength. So look at the strength. Patient maintains stable vital signs within acceptable limits. Patient maintains stable vital signs within acceptable limits. That is also great. Okay, so patient maintains stable vital signs within acceptable limits. It's a strength. Is that okay? Good. Let's look at the fourth one. Patient complains of loss of appetite. Loss of appetite too is another canker that is worrying a lot of you. You are able to identify it, but how to write the strength becomes a problem for some of you. Okay, good. So patient complains of loss of appetite. So you see, patient is very cooperative and can eat foods in bits and at frequent intervals. It's okay. It's a simple strength. Okay, so patient is very cooperative and can eat foods in bits and at frequent interval. Okay, or patient, even if you write and can eat foods in bits, is good. Please don't go and write patient can eat 50% of meals served. Hey, and you say patient is having loss of appetite. A patient, if let's assume you serve 3 balls of banku, and patients have been able to eat 50% of the 3 balls of banku, you said patients have lost appetite. That half, meaning that 1.5 food, it may be someone's appetite too. So please don't go and contradict yourself. Once you are writing the strength, don't go and state any percentage in there. Please be very careful. Okay, so patient has loss of appetite. Patients can eat in bits or can tolerate foods in bits. It's fine. Okay, or patient is very cooperative and can eat foods in bits. It's fine. Okay, let's look at the next one. Patient complains of being constipated. This is also another issue. Okay, so you see, we've been telling there are so many problems that you can write, and not to focus on anxiety and knowledge. There are so many problems. Okay, so patient complains of being constipated. Is that okay? How do you write the strengths? Okay, so patient can express willingness to make dietary and lifestyle changes. Okay, or you can even write patient is already drinking adequate amounts of fluids. It's a strength. Okay, so if patient can tolerate lifestyle changes or nutritional changes or dietary changes, okay, it's a strength. So patient is ready or willing to, make dietary changes. Do you get it? So patient is willing to make dietary changes. It's a good strength. Patient is willing to make dietary changes. It's a very good strength. Okay, or patient is already drinking adequate amounts of fluids. But the latter one, patient is already drinking adequate amounts of fluids. If you write that one, sometimes you are going to relate the nursing diagnosis to it. So please be very careful when you are writing that one. Don't write patient is already drinking adequate amounts of fluids. Then when we go to your nursing diagnosis, we see that you've written constipation related to inadequate intake of fluids. Please. Okay, so the candidates have written patient is constipated. Then the diagnosis, constipation related to inadequate intake of fluids. Please, you've contradicted yourself, because at the strength, if you write patient is already taking adequate amount of, then you can't say that is the related factor or the cause. Okay, that's why I've given you 2 sides of things you can write as strength. Most of the time you write patient is willing to make dietary changes. Patient is willing to make dietary changes. Simple as that. Patient is willing to make dietary changes. Okay, great. So patient complains of being constipated. Patient is willing to make dietary changes. Okay, simple as that. So let's see how you write the nursing diagnosis for the difficulty breathing. See how you write the nursing diagnosis for the difficulty breathing. Ineffective breathing pattern. Ineffective breathing pattern related to what? Airway obstruction. Once they give you patients on oxygen, this is how you write the nursing diagnosis. Ineffective breathing pattern related to what? Airway obstruction or inflammatory process of disease. Is this difficult? It's very simple. Ineffective breathing pattern related to what? Airway obstruction or inflammatory process of disease. Very simple as that. Okay. Now, look at the objective stroke outcome criteria. Patient breathing pattern would improve within 4 hours, as evidenced by nurse recording a respiratory rate within normal range. Then you state the normal range, 12 to 20 breaths per minute. But it will depend on the age of the person. If it is an adult, you can use this. But if it is a child, the range may change. Is that okay? Be mindful of that. But most of you are going to work on adult patients, so fine. You can be doing this. So patient breathing pattern would improve. Don't go and write patient breathing pattern will be restored to normal. You can't do any magical. Please, those who have been writing restore, please check that word very well. You can't do restore. Hey, within 2 hours, then you are going to restore breathing pattern. Please be very careful. Be very careful. So patient breathing pattern would improve. Always be using the word improve, improve, improve. Those who have been using restore as a word, please check it very well. Okay. Patient breathing pattern would improve within 4 hours, as evidenced by nurse recording a respiratory rate within normal range, so 12 to 20 breaths per minute, and patient verbalizing ease or comfort in breathing. Simple as that. Let's look at the nursing orders. Assess and record respiratory rate, depth, rhythm, and effort every 30 to 60 minutes. Patient's respiratory rate status was assessed early, and then respiratory rates noted. Do you get it? So you just write the past tense of the orders to get the nursing intervention. Position patients in high fowlers or semi-fowlers position to promote lung expansion. Encourage and assist with deep breathing exercises. Monitor oxygen saturation using pulse oximetry. Administer oxygen therapy as prescribed. Notify the physician if signs of respiratory distress worsens or oxygen saturation drops below 90%. You get simple as that. Then you see here, we wrote 4 hours. Look at the time over here. You see 4 hours. Then the time you wrote the problem is 8. So you add the 4 hours to what? To the 8. Okay. You add this 4 hours to what? To the 8. Okay. Then you get 12 p.m. Then you write the 12 p.m. over here. So you see the time here at the objective stroke outcome criteria is 4 hours. You add the 4 hours to the 8. Then you can now get the time you should write at the evaluation site. You get it. Then you write the time at the evaluation side quickly. Okay, great. So that is it. Let's look at how you write the problem for the nursing diagnosis for the swollen feet. So if you found out patient is having a swollen feet, patient is having edema, patient is having a swollen abdomen or edema abdomen, this is how you are going to write the nursing diagnosis. Look at it carefully. Excess fluid volume. Look, excess fluid volume related to disease process or compromised regulatory mechanism. Simple as this. Many of you are having issues with it too. You write a swollen feet, all right, but you don't know how to write a nursing diagnosis. Excess fluid volume related to disease process, or you can relate it to compromised regulatory mechanism. Okay, excess fluid volume related to disease process or compromised regulatory mechanism. Let's look at how you write the objective stroke outcome criteria. So patient fluid retention or swelling feet or edema, depending on which word you used when you were writing the problem. You see, I've written different dimensions depending on the word you use when you were writing the problem. So if you use fluid retention, then you know which word where to. If you use swollen feet, you know how to draft the objective. If you used edema, you know how to write it. So if you use edema, it will be this way. Patient edema will reduce. You see how it goes within 48 hours, as evidenced by. Okay, and mind you, if you are going to write such a problem, you definitely have goal partially met, because you can't solve edema immediately on the day of the exams. So you should be expecting to write goal partially met. So you see the time that we gave. Patient edema will reduce within 48 hours, as evidenced by nurse observing decreased swelling, improved abdominal girth, stable weight, and normal urine output. So patient fluid retention or swollen feet or edema will reduce within 48 hours, as evidenced by nurse observing decreased swelling, improved abdominal girth, stable weight, and normal urine output. Simple as that. You see, it's very, very simple. Then the nursing orders: assess and monitor vital signs, especially blood pressure and heart rate, every 4 hours. Measure and record intake and output strictly every shift. Monitor daily weight at the same time each morning. Okay, assess for extent and location of edema. Okay, elevate swollen limbs when resting to improve venous return. Administer prescribed diuretics, or you can simply write administer prescribed medications. Okay, another thing. Okay, so even vital signs is even there. Do you get it? Then you write all of them in past to get your interventions. Very simple as that. Is that okay? Very simple as that. Let's look at the general body weakness, how you write it as a problem. Look at how we write the general body weakness. Okay, and you know the funny thing, some people will write activity intolerance, then they relate it to general body weakness. How? Once you write, once the problem you've written, once the problem, let me show you a trick. You see, the problem you've written is general body weakness. Now, listen, what you are writing as the diagnosis, this first part, see, this first part, activity intolerance, this first part, this activity intolerance is representing the general body weakness. So you see the problem some of you make. It means that you've written problem related to problem. Okay. In the nursing diagnosis, the first part is representing the problem that you've written. So if you say the nursing diagnosis activity intolerance, that activity intolerance is standing in for the general body weakness. So you can write activity intolerance related to general body weakness. Then it means that you've related problem to problem, because nursing diagnosis is problem related to cause. Do you get it? So the activity intolerance is actually representing the general body weakness that you wrote as a problem. Okay, so look at what I related it to. So activity intolerance related to disease process or an imbalance. So if you are dealing with patients on oxygen or something, then an imbalance between oxygen supply and demand. That's if you are dealing with a patient with respiratory condition. Okay, but advice I'll give you, activity intolerance related to disease process. Simple as that. Okay, don't write activity intolerance related to general body. Then it means that you are now considering the general body weakness as a cause. So it shouldn't appear under your patient's problem. It shouldn't, because you've stated it as a cause. Is that okay? So it shouldn't appear at your patient's problems. Let's look at the objective stroke outcome criteria. Patient tolerance to activity would improve. You see, don't go and write patients will become active or patient activity tolerance will be restored. Please, those who are fond of using restore, be very careful when you are designing care plan. So patient tolerance to activity will improve. You see how simple it is. Patient tolerance to activity would improve within 12 hours. Okay, as evidenced by nurse observing patient perform basic tasks, setting up, okay, walking short distances with minimal or no symptoms of fatigue or breathlessness. Is that okay? Then the nursing or assess patient's level of activity, monitor vital signs before, during, and after activity. Encourage energy conservation techniques like resting between tasks or resting between activities. Assist patients with mobility tasks as tolerated. Is that okay? Collaborate with physiotherapists or occupational therapists for graded activity plan, or collaborate with physiotherapy to plan patient activity. Then educate patients on signs of overexertion, when to stop activity, when to start activity. You get it? So this is some simple orders that you can use. Obviously, if you are writing activity intolerance as a problem or general body weakness as a problem, you can't write a goal fully met. You should be looking at goal partially met. Okay, so you see the objective stroke outcome criteria that within 12 hours, do you get it? Within, even that one I use would improve within 12 hours. Is that okay? Great. Let's look at the next one. So we are going to look at this. Loss of appetite. The loss of appetite. People write strange diagnosis. Very funny diagnosis. Look at it. The imbalance. Do you know that some people will write imbalanced nutrition into brackets less than body requirements? Then they relate it to loss of appetite. So it means that once you do that, it means that you've accepted that the loss of appetite is not a problem. It's a cause. Because, see, nursing diagnosis is your problem related to your cause, the cause of the problem. Problem related to the cause of the problem. So if you write a certain diagnosis, then you come and write related to loss of appetite. Then now you are telling us that or you are now teaching us that loss of appetite is no more a problem, it's rather a cause of a problem. So that's why I'm emphasizing that. See the first part of the diagnosis that you've written representing the problem. So look at this. Imbalanced nutrition into bracket less than body requirements. Do you get it? Related to decreased appetite. So if you write it this way, then it means that you are now approving that the loss of appetite is rather a cause. You get, and this is what most of you will write. Okay, it should rather be imbalanced nutrition less than body requirements related to the disease process. Do you get it? Once you write related to decreased appetite, then you see the decreased appetite you've written here. This decreased appetite. Then you are telling us that the decreased appetite is no more a problem. It's rather a cause of a problem. Do you get it? So you rather relate it to what? The disease process. And mostly it's the disease process that brings about the loss of appetite. Do you get it? So imbalanced nutrition. I think with the new NANDA, they have something like inadequate nutritional intake. What do you have in the new NANDA now? Something about nutritional intake. What do we have in the new NANDA regarding the imbalanced nutrition? There is something like inadequate nutritional intake, something like that. Check it. So that inadequate nutritional intake would rather be representing the loss of appetite. Do you get it? Then you can relate that to the disease process. Okay, or sometimes you can relate that to, yes, you can relate that to the disease process. So don't write inadequate nutritional intake related to loss of appetite. Then once you write that, then it means you should make changes to the problem you've written. Do you get it? So imbalanced nutrition, you can also write this imbalanced nutrition into bracket less than body requirements related to disease process. You get something like this. So related to disease process. Okay, related to disease process. So you can write something like this. Okay, imbalanced nutrition into bracket less than body requirements related to disease. That imbalanced nutrition is representing the loss of appetite, which is the problem. Once you come and write related to loss of appetite, then now that loss of appetite is not a problem. It's rather you are considering it rather as a cause. Is that okay? So here you can make it risk for imbalanced nutrition. Is that okay? So here there is not imbalanced nutrition, so you can rather make it risk for. You see how I've made it? Risk for imbalanced nutrition, something like this. Okay, so risk for imbalanced nutrition. Okay, look at this. Risk for imbalanced nutrition into bracket less than body requirements related to disease process. You see how it is? Risk for imbalanced nutrition into bracket less than body requirements related to disease process. Don't write it the first one, imbalanced nutrition, because once patient is having loss of appetite doesn't mean patient is having imbalanced nutrition. No. Okay, so risk for imbalanced nutrition into bracket loss of appetite related to disease process. Is that okay? Great. Now let's look at the objective stroke outcome criteria. Look at the word I'm using. Don't go and say patient's appetite will be restored, please. So I keep saying those who have been writing restore, be very careful. Those who are fond of writing using the word restore, be very, very careful. So look, patient will demonstrate improved appetite within 24 hours, as evidenced by nurse observing patient consume at least 70% of each meal. Is that okay? So you see how simple it is. Patients will demonstrate improved appetite within 24 hours, as evidenced by nurse observing patient consume at least 70% of each meal served. Simple. The next orders assess patient intake, dietary intake and food preference. Monitor daily weight and nutritional status. Offer small frequent meals and preferred foods. Encourage oral hygiene before meals. Collaborate with dietitian to plan patient meal. Provide calm, pleasant eating environment. You see how simple it is. Very, very simple. Do you get it? And here, such a problem, if you write loss of appetite, definitely you'll be having goal partially met. Do you get it? You will definitely be dealing with goal partially met. Okay, now let's do the constipation. You see the diagnosis: constipation related to reduced bowel motility and decreased fluid intake. That is why I was saying that if you write constipation as a problem, okay, don't go and write the strength. Don't go and write patient is already drinking adequate amount of fluids. Then your diagnosis. I noticed some of you will write patients complaints of being constipated. Then the strength, they write patient is already drinking adequate amount of fluids. Then when they write the nursing diagnosis, they write constipation related to inadequate fluid intake. You've contradicted yourself, because the strength, you stated that patient is already drinking adequate. So why are you now relating the constipation to inadequate fluid intake? Do you get what I'm trying to say? That's why I was saying that instead of writing patient is already drinking adequate amounts of fluids, write patient is willing to make dietary changes. You see the thing? Patient is willing to make dietary changes. If you write it that way, then you can still go ahead and relate the constipation to inadequate fluid intake. So it could be patient is taking adequate fluids, but the constipation is coming from maybe other dietary requirements, like maybe lack of fiber. You get it? A different thing. Okay, so constipation related to reduce bowel motility and decrease fluid intake. Constipation related to reduce bowel motility and decrease fluid intake. Okay, good. So look at the objectives to outcome criteria. Patients will be relieved of constipation, or you can even write patient bowel motility would improve. Okay, or you can write this: patients will be relieved of constipation within 48 hours, as evidenced by nurse observing patient pass a soft form stool and patient verbalizing that he is no more constipated. Simple. Patient will be relieved of constipation within 48 hours, as evidenced by nurse observing patient pass a soft formed stool and patient verbalizing that he is no more constipated. Let's look at the others. Monitor bowel movement, frequency, consistency, and associated symptoms. Encourage fluid intake. Promote high fiber diet intake. Assist with short walks in the hallways or within the ward. Prescribe stool softness given after meals. Encourage ambulation or range of motion exercise. Administer stool softness. Okay. Like, for example, laxatives and all those medications. Educate patients on avoiding prolonged suppression of the urge to defecate. You get it? So basically, that is it for constipation. Okay, so constipation related to decreased fluid intake. Simple as that. Or constipation related to reduced bowel motility. Okay, good. I prefer that you always do constipation related to reduce decreased fluid intake or decrease fluid intake or reduce bowel motility. Okay, simple as that. Okay, now let's go to another set of problems. So we've done 5 sets of problems. Let's look at other sets of problems. So we have high body temperature. High body temperature. Before I look at this new set of problems, let me chip in some of the key things or some of the recurring issues with the practical. Certain tasks that you may have to talk. Okay, there are certain things that you may have to talk, especially when you are improvising. Let it be clear, speak it out. That, oh, this thing is not available, so because of that, I'm doing this. Okay, and for example, those who are doing feeding, you've been asked to do feeding. The part that you have to pray, make sure you pray. Do you get it? So instead of saying that, or would you like me to pray, or you would want to pray yourself? You can just offer, make it lively. You can just offer to do the prayer yourself, so that you see, if you offer to do the prayer yourself, it makes it so visible or so clear for everybody to see. Do you get it? So, be very audible. And sometimes some parts of the procedure, sometimes the examiners may not be there. For example, you finish the procedure, certain things like going to discard the trolley or going to discard your tray, okay, washing your hands and documenting, say it audibly. Let the examiners hear you saying it. Oh, sister, please, I will discard my trolley, especially those who do make beds. You finish making the bed. What next are you going to do? Then they are standing there. And before you make the beds, to make sure you wash your hands. Before you go and make the bed, it's an error most of you commit. Before you make the beds, you make sure you wash your hands. And after the bed making too, you wash your hands. It's something most of you forget to do. Okay, it should be done. Either than that, you score something low over there. Do you get it? So you make an attempt, or you discard your trolley, you go and wash your hands, make an attempt to go and wash your hands. And sometimes you should come with hand sanitizers, so that when you finish, you pour some in your hands, you pour some in your assistants also hands, for them to clean their hands. Okay, so that the examiners see you doing it clearly. Okay, so there is no space for them to give you something low. Do you get it? So, sister, please, I'll discard my trolley. I'll go and wash my hands. My assistant too will wash the hands. Do you get? Then I'll document and come and show it to you. Say it confidently. Get them. Do you get it? And some of you, I don't know your intention, whether you are trying to commit error. Speed is also part of the practical. So, yes, those who get the 4, they are people who do it with speed. Doing it with speed too doesn't mean you do it in a way the examiners don't see what you are doing. Okay, because some of you come, it's like slow. They are making bed. It's as if they are doing the things slow. If you are doing that, doesn't mean you are impressing the examiner. Because speed, go and check the assessments for the steps. Speed, those who do it at speed and competently, they get the 4. So if you come and you are doing it slow, it means you've completely taken yourself out of that percentage or that category who will be able to hit the 4 score. Please and please and please. Slowness doesn't mean you are impressing any examiner. Being slow and being overly, doing things slow doesn't mean you are impressing any examiner. You are rather taking yourself from the group that can score or hit the 4 marks for the steps. Okay, great. And then another thing is that with your setup, be very careful, set up properly so that you don't hesitate during the procedure. Okay, you are going to give intramuscular medications. Set up properly. Don't go there without the sharp box. Some of you will come without the sharp box. Then when they finish, they are discarding the needle, because the needle should go straight into the sharp box after the injection. It's a step. It's a step. The point where you have to put the needle, okay, and the syringe into the sharp box is actually a step. So if you put it in the receiver, you've lost it. If you go and drop it in the receiver, you've lost it. It should go straight into the sharp box so that you get that mark. Okay, so please make sure you do the right thing. Do you get it? Good. So always make sure your setup is complete. Okay, so let's look at other set of problems. So another set of problem you can have on the ward. So there's like 5 different sets of problems. You've done 5 already. Okay, and you see, still we've not discussed anything about anxiety and knowledge deficit. That should tell you there are so many problems. On this slide alone, there are more than 40 problems. Okay, that you can have for patients without even talking about knowledge deficit and anxiety. So patient has a high body temperature. How are you going to write the strength? Patient has a high body. Patient is well hydrated. Patient is cooperative. Patient is able to report discomfort and symptoms. It's fine. Patient has a high body temperature. Patient is well hydrated. Patient is very cooperative and able to report discomfort or symptoms. Very simple. Now, the second one, patient cannot clean her mouth without assistance. Okay, patient's mouth has not been cleaned. Okay, look at how you write the strengths. Patient is very cooperative and willing to receive assistance with oral hygiene. Okay, let's look at the third one, which is a very common one people have been writing. Is that okay? Patient complains of dizziness. This is one of the common problems people have been writing. Patient complains of dizziness. Look at the strengths. Patient is conscious, alert, and able to request support when feeling dizzy. So patient complains of dizziness. Patient is conscious, alert, and able to request support when feeling dizzy. You see, simple as that. We've done the difficulty breathing already. Let's look at the difficulty sleeping. Patient complains of difficulty sleeping. Patient complains of what? Difficulty sleeping. Okay, let's look at the strength. Patient is mentally oriented and open to relaxation guidance and education. Or patient is very open to relaxation guidance and education. Patient is very open to relaxation guidance and education. You see, patient is very open to relaxation guidance and education. Simple as that. Is that okay? Great. Now let's look at the oral hygiene. So ineffective oral hygiene behaviors related to general body weakness. This is what you should relate it to. Okay, ineffective oral hygiene behaviors related to general body weakness. So patients will be assisted to care for her mouth within 40 minutes, as evidenced by nurse observing patient's mouth looking clean. Patients will be assisted to care for her mouth within 45 minutes, as evidenced by nurse observing patient's mouth looking clean. Okay, the nursing orders assess patient's ability to cooperate with oral care, set up a clean trolley with materials for mouth care, assist patients into a comfortable or sitting or lying position, perform oral care using soft Bristol brush and antiseptic solution, inspect the oral cavity for lesions, dryness, or odor, educate patients on the importance of regular oral hygiene. Okay, look at hyperthermia. Hyperthermia, into brackets, 38. Someone will write, patient complaint of feverishness. Which one is that? What is feverishness? Patient complaint of feverishness. What is the meaning? If it is high body temperature, go straight. Patient has a high body temperature. All right, patient complains of feverishness. So, because you have to state hyperthermia, into bracket, 38 degrees Celsius, related to infectious process of disease. Hyperthermia, into bracket, 38 degrees Celsius, related to infectious process of disease. Objective or outcome criteria: patient body temperature will reduce to normal range. Then you state the normal range, 36.2 degrees Celsius to 37.2 degrees Celsius within 2 hours, as evidenced by thermometer reading and patient verbalizing relief from heat symptoms. So patient body temperature will reduce to normal range, into bracket, 36.2 to 37.2 degrees Celsius within 2 hours, as evidenced by thermometer reading and patient verbalizing relief from heat symptoms. As simple as that. The nursing orders: monitor and record the patient temperature every 30 to 60 minutes. Encourage oral fluid intake to prevent dehydration. Provide tepid sponging or cooling measures as needed. Keep patients in a well-ventilated and lightly clothed environment. Observe for signs of complications. Administer prescribed antipyretics as orders. Recheck patient temperature. Do you get it? So then we have the dizziness. The dizziness, this is what you write. Risk for adult falls. If it is a child, you write risk for child falls. So risk for adult falls related to disease process. Risk for adult falls. Some people will write risk for adult falls related to dizziness. So this is what I've been teaching you. Remember that risk for adult falls that you ask is there representing the dizziness. Okay, so the moment you write dizziness as a problem, then we come to your nursing diagnosis written race for adult force or race for force related to dizziness. It's wrong because that dizziness there is standing in that race for adult force is standing in for. Once you relate it to dizziness, then you are saying that the dizziness is rather a cause of a problem. So you've done problem related to problem instead of problem related to cause. So race for adult force or race for injury. Some people to write race for injury, race for adult force related to disease process. Simple as that. So the race for adult force is standing in there for the problem that you've risen. Is that okay? Objective stroke outcome criteria. Patients will remain free from force during the shift or within 8 hours, as evidenced by nurse observing patients maintaining safety with no physical injury. You see, patients will remain free from force during the shift or within 8 hours, as evidenced by nurse observing patients maintaining safety with no physical injury or with no force. Simple. Assess the level and frequency of dizziness. Monitor for vital signs regularly. Okay, that is the temperature, pulse, respiration, and blood pressure. Keep call bell within patient reach and educate patients on how to call for help. Assist patients with all movement, getting out of bed, walking, using the toilet. You get it. Ensure the environment is free from clutter and slippery hazards. Place patients in a low bed with side rails up if necessary or when necessary. Okay, so basically that is how you write. Let's look at the sleeping, the patient complaints of difficulty sleeping. Now, another thing with the sleeping is that anytime you are writing patient complaints of difficulty sleeping, add the time. Is it during the night or during the day? Do you get it? Because see, most of the time you are doing the care plan during the day. So if you write patient complain of difficulties during the day, of course, obviously, usually they are not asleep. So patient complains of difficulty sleeping at night. You get it? Is it so? Be specific with the problem. Is it during the night or during the day? So patient complains of difficulty sleeping at night. That is something you should pay attention to. Okay, so look at the diagnosis. Ineffective sleeping pattern related to environmental disturbance or stress, or you can relate it to change of environment, or sometimes if there is pain, you can relate it to the pain as well. Okay, so patient complaints of difficulty sleeping. Okay, patient complaints of difficulty sleeping. Okay, patient ineffective sleeping pattern related to change of environment. Ineffective sleeping pattern related to environmental disturbance. Ineffective sleeping pattern related to pain at so and so parts of the body. Ineffective sleeping pattern related to stress. Okay, let's look at the objective. Patient sleeping quality. Look at the word I'm using. You see, I didn't say restore. You see, I've been using the word restore, restore, restore. Be very careful. Patient sleeping quality would improve. You see, I'm using the word improve. Patient sleeping quality will improve within what hours? 5 hours, as evidenced by nurse observing patients sleep uninterrupted for at least 4 to 5 hours. Is that okay? Assess patient's sleep habits, bedtime routine, and any underlying stresses. Encourage patients to avoid caffeine or stimulant close to bedtime. Promote a quiet, dark, and comfortable sleeping environment. Encourage the use of relaxation techniques such as deep breathing or listening to soft music. Limit interruptions during the night. Okay, administer prescribed sleep aids or sedatives. You see how simple it is. Very, very simple. Is that okay? Very, very simple. Okay, now let's do this last set of problems. There are more, but let's do, anyway, let me touch on the education and pain issue. So patient complaints of pain, some of you are still writing pain without specifying where the pain is, which is not good, because at this time where this very point where we've advanced, we are not expecting you to write patient complaints of pain without specifying the location of the pain. So patient complaints of pain at the lower abdomen. Patient has a surgical wound at the lower abdomen. Okay, you see, I'm being specific with the problems that I'm writing. Patient, and some people are still writing, patient is anxious. And in this age and time where we've advanced, we are all almost nurses. All right, patient is anxious. Patient is anxious of the outcome of condition. Patient is anxious of impending surgery. Patient is anxious of, in fact, I always advise that just write patient is anxious of the outcome of condition. It's okay. Don't go and write in. You write patient is anxious of the outcome of condition. Is that okay? Patient has inadequate knowledge on condition. Okay, then you write into brackets hernia. Patient has inadequate knowledge on condition into brackets. You get it? Don't be using words like patient has little knowledge on condition. Okay, in fact, even the inadequate, please go straight and write patient has no knowledge on condition. That makes it a more, it makes it a better problem. Do you get it? It defines the existence of the problem better than saying patient has little knowledge, patient has less knowledge. Okay, patient has no knowledge on hernia. Patient has, or you can even use the word inadequate. The reason is because in the diagnosis itself, they make room for the word inadequate health knowledge. That should tell you the diagnosis even recognizing it as inadequate. Okay, instead of using the no knowledge on condition. Okay, so either you are using patient has no knowledge on condition or patient has inadequate knowledge on condition. The reason is because even the diagnosis in the NANDA itself is now defining it as inadequate. So that means that even if you write patient has no knowledge on condition, the NANDA diagnosis itself consider it as inadequate health knowledge. Do you get it? And even first, previously, it was still deficient knowledge, which doesn't mean no knowledge. Is that okay? Good. That's why I'm saying that you can make use of this word. Patient has inadequate knowledge on condition. Then you bring a bracket and specify the condition. Or you can go straight and write, patient has inadequate knowledge on hernia. Patient has inadequate knowledge on stroke. Patient has inadequate knowledge on hypertension. Patient has inadequate knowledge on sickle cell disease. Do you get it? Good. Then the strength. Patient is willing to be educated on condition. The anxiety to patient can express his fears and worries. Okay, so for pain, I think now you guys are masters of pain. Acute pain into bracket lower abdomen related to inflammatory process of disease condition. Okay, great. So basically, that is it. Okay, so impaired skin integrity into bracket surgical wound at the lower abdomen related to surgical intervention. Those of you who be doing wounds, impaired skin integrity. Don't go and write a patient is having wound. Then you rather go and write risk for infection. The wound is there. Go straight and write impaired skin integrity. Don't go and do the wound rather. Because the patient is having a wound. The wound is there. It's clear. Go straight. Diagnose the wound. Impaired skin integrity into bracket surgical wound at the lower abdomen related to surgical intervention. Go straight and concentrate on the wound. Don't go and write patient is having a wound. A surgical wound is there. Then you go and write risk for infection. No. And most of the time, what I observe, those who write it, still the interventions or the orders they'll be writing and the outcome criteria, they will still be talking about wound. So I wonder how you rather decide to go and write the risk for infection. So impaired skin integrity into bracket wound at the lower abdomen related to surgical intervention. If the wound is as a result of surgical intervention, you relate it to surgical intervention. If the wound is as a result of the disease process, you relate it to the disease process. It's not all wounds that are as a result of surgical interventions. For example, diabetic foot. It's as a result of the disease process. So impaired skin integrity into bracket wound at the lower limb. Right lower limb related to disease process. Simple as that. Patient wound will be cleaned within 45 minutes, as evidenced by a nurse observing patient wound looking clean. Assess the state of patient wound. Set a trolley for wound dressing. Assist patient into a comfortable position. Dress patient wound aseptically. Educate and encourage patient to eat foods rich in proteins. Administer prescribed antibiotics. You see how it goes. Good. But then if a patient is not having a wound, for example, do you know if a patient is actually having a pressure sore? That one too, you go straight and tell us that it's pressure sore. if a patient is having pressure, so that one too straight. Is that okay? So you tell us, patients, that one too is a wound. So if you write the same diagnosis. So patient impaired skin integrity into bracket pressure sore at the sacral region related to prolonged lying in bed. Do you get it? That one, if you are writing the problem, you write it, patient has pressure sore at the sacral. You don't write patient is bedridden. If you are writing patient is bedridden, then that one is risk for impaired skin integrity. This one. So that one is going to be this one. See, risk for impaired skin integrity into bracket pressure sore related to prolonged lying in bed. Okay, then the objective stroke outcome criteria will be patient pressure areas will be treated within 45 minutes as evidenced by nurse observing patient pressure areas being treated and looking intact. Is that okay? Great. I think I'll end over here. Okay, I'll end over here. So in the practicals, be very confident. Okay, I'll have another section with you before the Viva Voice. Okay, yes, on the Telegram page, I have all my Viva students for the mock on the page. So I'll have another section with you before the Viva Voice, so that I guide you on some of the expectations. Okay, how you should prepare and other areas that you should consider during your preparation. Okay, so I wish you all the best. We should be touching into that. I wish you all the best. I'll still have another meeting with you again before you go in again for the next meeting. I believe it's not all of you that are going in today. So I will still have another meeting with you so that those who are not able to join for this section, they can benefit from that section. I wish you guys all the best. So far, so good. All the best to you guys. Bye-bye.